How to treat constipation. Constipation treatment. Constipation is often treated only by modifying the lifestyle of the sufferer, which includes changing the type of foods and drinks that the person consumes, increasing movement and sports, and doing exercises that facilitate bowel movement. Intestines, and it may resort to surgical intervention as well, and we will mention many other tips in detail. Adopting a healthy lifestyle. Treatment for constipation usually begins with making some necessary changes to facilitate and speed up stool movement in the intestine, by following a healthy lifestyle. Among the advice that the doctor may give to the sufferer who suffers from constipation, we mention the following. Increase your intake of fiber due to its role in enlarging the size of the stool and speeding up its passage in the intestine, so the patient begins to eat specific amounts of fresh vegetables and fruits daily, as well as wheat grains or whole grains, and it is worth noting that consuming fiber in large quantities suddenly will lead to bloating and the formation of gases, so it is imperative to introduce fiber into the diet slowly and in measured amounts. Not neglecting the need for excretion and taking the sufficient time to expel the excreta without rushing or distracting attention. Exercising most days of the week, because movement increases muscle activity in the intestine, and it is therefore necessary to consult the treating doctor about the general health condition of the injured if it allows him to exercise, and start with it immediately after setting the appropriate program. Drinking more water to avoid dehydration. Raise the feet on a small stool while using the toilet, so that the knees rise above the level of the sink, making it easier for waste to pass. Consult the attending physician in the event that the constipation is caused by a specific medicine used by the patient. The doctor may resort to substituting it with another alternative. Laxatives. Laxatives are one of the types of drugs that help empty the intestine from their content and treat constipation. Enemas, or suppositories, and laxatives are used after failed lifestyle changes and exercise in treating constipation, and are divided into types that we separate as follows. Laxatives. Problem mass. Bulk-forming laxatives, one of the types of laxatives which prevent constipation by increasing the size of the stool, by increasing the absorption of water from the intestine, thus becomes a stool softer configuration and easier movement. Known laxatives. Problem of mass. Supplements fiber, and it is worth noting that this type of laxative needs a period ranging between 1 to 3 days to take effect, and therefore it is not suitable for rapid relief from constipation, and these laxatives are used to treat conditions that require moving the intestine more, such as irritable bowel syndrome and hemorrhoids and others. It is worth noting that this type of laxative is not given directly before bed, and other medicines should be avoided within 2 hours of taking laxatives that form the mass. Osmotic laxatives. These laxatives soften the stools by increasing the flow of water through the intestine, where osmotic laxatives are made of small molecules such as fibers, sugar, or proteins that increase the amount of water entering the colon lumen by a process known as leaching. Osmosis, and this process aims to equalize the concentrations of fluids and solids inside and outside the lumen of the intestine, and accordingly, the principle of action of these laxatives is to increase the water entering the colon. Pharmacological treatments. The doctor resort to prescribing drug treatments that require a prescription in the event that the previously mentioned treatments fail, especially if the patient suffers from irritable bowel syndrome, and among these drugs we mention the following. Serotonin HT5 receptors, also known as 5-hydroxytryptamine, serotonin 5-hydroxytryptamine 4 receptors, such as the drug prucalopride, as these drugs help the colon move the accumulated stool inside it. The patient had long-term constipation for an unknown reason. Drugs that pulls water into the intestines. Operate these drugs, as the name suggests, to pull water into the intestine to facilitate and accelerate the stool movement as it regulates bowel movement if the patient is suffering from colon irritable syndrome. Examples include blaconatide, placonatide, which is also used to treat persistent constipation for a long period of time without a known cause. Peripherally acting mu-opioid receptor antagonist. These drugs are prescribed when the cause of constipation is the use of opioids as pain relievers, as these drugs counteract the action of opiates on the intestine and restore its movement to normal. Surgery. Surgery can be resorted to if all the previous treatments did not work, and the choice of surgery depends on the cause of the constipation, such as the presence of a blockage in the intestine, or due to the presence of an anal fissure, or because of the rectal prolapse, rectum prolapse. It is the exit of part of the anus outside the body, and constipation resulting from a malfunction in a part of the colon may require the removal of this part surgically. See a doctor. In fact, does not raise constipation anxiety usually, but in some cases it may be an offer to the case of other conditions such as diabetes, and Parkinson's disease and stroke sclerosis and multiple sclerosis and others, are advised the patient waits for 3 weeks when suffering from constipation and then sees the doctor, except in some cases in which the patient must see a doctor immediately in the event that it appears, and in turn to perform the necessary tests that include analyses, X-rays, and colonoscopy. To find out the main cause of constipation, and among these cases we mention the following: the appearance of blood with stool, not having had a bowel movement for 1 week, unexplained weight loss, not being constipated before, a family history of colon cancer or irritable bowel syndrome, constipation accompanied by vomiting or severe abdominal pain, sudden constipation, in addition to feeling pain in the abdomen and inability to pass gas. For any inquiries or questions, add your comment. And don't forget to subscribe and activate the notification to receive all new